One thing about hypertension is that some people don't even know that they have hypertension because it's a silent killer, so you won't even know that you have it. And then some people don't even believe. Some are living in denial. They know that they have it, but they are living in denial. They don't want to believe that they have hypertension, and they don't want to do anything about it. Do you understand? And some don't even know that this hypertension we're discussing about is on the rise amongst young people. Young people are those that are below the age of 45 years. It is rising all over the world. That is, hypertension is on the rise all over the world among these people that are of young age. And then some people don't even know the implications of hypertension. Some don't know that this is a terrible disease that can affect all the systems. They affect the brain, the heart, the kidneys, everything in the system, the eyes, how terrible it is. Everything you can think about, hypertension can destroy it. Some don't even know that the fact that we are having rising cases of kidney failure is because one of the reasons is because of hypertension, because hypertension is the major cause. One of the major causes of rising kidney failure in our environment all over the world is hypertension, atrial hypertension, and it is a terrible disease. What can we do? How are we going to go about it? Everything is contained in this video you are going to watch now. There are basically 3 things I will tell you and few other things that you need to know about hypertension naturally that you will do, and you see yourself recovering from it. You see yourself getting rid of hypertension in your system, especially when you know that you have the risk factors. Now, what are the risk factors? What are the things that you will have and you will know that you have hypertension, or you are likely going to have hypertension? Everything in this video. So now follow me as we go down to discuss about this thing. Just follow me as we go down to discuss about it. So you're welcome back once again. Now, when we talk about hypertension, what we're trying to say is that the blood pressure of the individual that has been measured is greater than or equal to 140 in terms of the systolic over 90. Greater than or equal to 140 over 90. That is blood pressure. In 2 occasions, separated at least 4 hours apart. So you must have checked that blood pressure in 2 occasions, at least 4 hours apart, with the BP being above or equal to 140, that is systolic, and then one that is diastolic. There is one that is below, being 90. Now, I want you to understand that there are different types of hypertension. Hypertensions are of 2 types. Number 1 is what is called essential hypertension, and the second part is what is called secondary hypertension. The essential hypertension is the majority of hypertension, which is 95% of hypertension. So most that are hypertensive are in the class of essential hypertension, meaning that we don't know what is causing this hypertension. But when we talk about secondary hypertension, means that there is a particular cause in this case. Now, when we're discussing about this management, now we are in particular about the majority of people, where people, most people, especially young people in this country, in Africa, and the whole world are going to fall into. Now, I want to beg you to support this video by sharing it and then subscribe to this YouTube channel. Your subscription does not cost you any money. It's just to support us and then to tell YouTube the number of persons that are following up what we are doing on this channel. Now, I want to tell you also that there are different classifications of hypertension. Now, when we say your BP is normal, we mean that your BP is less than 120. That systolic is less than 120 and the diastolic is less than 80. That is normal or optimal hypertension. Now, when we say your hypertension, you have what is called pre-hypertension, meaning that your BP is 120 to 139. That is systolic. Systolic one that is above, and then 80 to 89. That is pre-hypertension. When you have what is called stage 1 hypertension, meaning your BP is 140 to 159. That is stage 1 hypertension, systolic, and then diastolic is 90 to 99. That is stage 1. Then stage 2 hypertension means that your BP is greater than or equal to 160. That is systolic, the one that is above, and the one that is below is greater than 100. That is stage 2 hypertension. Now, if you're a young person and you have what is called stage 1 hypertension, this video is for you. You can be managed. If also a young person, when I say a young person, I want you to understand what I mean. You are less than 45 years or equal to 45 years. I mean, you are less than 45 years, you're a young person. Now, if you are also an adult and you are stage 2 hypertension, This video is also for because despite the fact that you are taking drug, this part of what I'm going to tell you in this video is going to help that drug you are going to be taking, so it will start working and working effectively to the point that you may even stop taking the drug as well. Then if you're a young person and you have this stage 1 hypertension, and then you don't have any comorbidities, and you are not pregnant, for instance, you're a woman, you're not pregnant, and you'll be forced within this range, you are going to do something, and you don't have other comorbidities. I was talking about comorbidities. There is any underlying disease. For instance, you don't have what is called bad dyslipidemia, otherwise called bad cholesterol. You don't have obesity, you are not obese. You don't have underlying heart disease, for instance, coronary heart disease. You don't have kidney diseases, or you have not had stroke. You don't have stroke at this point, and you have stage 1 hypertension. Do this thing I'm going to tell you now. That will help you. And you're a young person, if you have stage 1 hypertension, do exercising. Exercising has been proven scientifically. So that's the first thing, one of the first things you are going to do in the treatment of hypertension. Why would you allow hypertension to kill you? Why? Meanwhile, you know what to do. Do you understand? Why can't you have a lifestyle modification, even if you have any of these comorbidities? Now, when I talk about exercising on this channel, I know why I'm talking about it. The importance of exercising. When I talk about exercising in this case, I'm talking about aerobic exercise, otherwise called isotonic exercising. You will begin to ask me, what type of exercise should I do? I have talked about exercise that you do to help your system. For instance, walking, brisk walking, jogging in the morning or in the evening, running or swimming or playing football or table tennis. These are forms of aerobic exercise. The other one, or like something like skipping, these are forms of exercising that you can do to help you. Now, how does exercise come into in this thing? How does exercise bring about reduction in atrial hypertension? One way it does this is by causing what is called vasodilatation, peripheral vasodilatation. Now, you have to understand something. When an individual has atrial hypertension, in most cases of atrial hypertension, there is something called peripheral resistance. Peripheral resistance meaning that the blood vessels, I was talking about vasodilatation in one of my videos, when I was talking about how exercise helps men in sexual activities. I was talking about vasodilatation. Now, in peripheral resistance, the blood vessels, the lumen of the blood vessels are so constricted, that is so small that the blood does not pass through it freely. So blood is flowing at high or intense velocity and is hitting on the wall so much. But when you exercise, the body will release what are called vasodilators. These vasodilators will relax the blood vessels so that you now have vasodilatation and blood will flow. So you have peripheral vasodilatation. Now, when you are exercising, of course, the body temperature increases. There is hotness in your system. That hotness causes blood vessels to relax so that blood will flow slowly. This is one of the ways exercising, especially aerobic exercising, helps in the regulation of blood pressure and then reduction of hypertension. That's one of the ways it does that. Another thing that exercising do is that it causes the heart not to be beating fast. There is something called SA node, sinoatrial node, that is in the heart, and that is the point where the electrical activities of the heart starts from. Now, at that point, it causes what is called negative feedback inhibition. By causing that point that causes the heart to beat fast to relax, instead of beating fast, it reduces that beating of the heart. That is why in people that do athletics, all those athletes, for instance, footballers, marathon people, they have what is called bradycardia, or otherwise called reduction in heartbeat or heart rate. That is one thing exercise does, and by doing so, the rate at which the heart is pumping blood to the vessels is reduced, thereby causing reduction in blood pressure. And one of the ways it does that. Also, exercise helps the heart to contract very well. Now, when the heart is contracting very well, it does not need to beat so much or pump much blood like that, just little blood. And because you have already have vasodilatation, that is the tissues, the blood are flowing smoothly. The heart doesn't need to push at higher pressure in order to pump blood. Just more blood has already flowed. One of the things you do is exercise. Another thing you are going to do is by reducing salt intake. Most of us, especially in this time, used to take plenty of salt in different things we are taking, both from industrialized salt and different all these kind of food we are eating these days. That is one of the things that will cause you to have hypertension. Excessive salt intake. I am telling you that if you are eating natural food, most of the natural food we are eating, so all of them, they have their own peculiar amount of salt that naturally God has already put in them. So you don't need to add salt. Whenever I am saying this, people used to be like, why are you talking like this? I am telling you that each food has its own amount of salt. 1 gram of rice, the amount of salt in it naturally is not the same with 1 gram of beans. That's how it is, and God has made it to be that way. This is one of the things that will help you to prevent hypertension and also reduce it. Assuming you have already had it. Even if you have stage 2 hypertension and you involve in exercising and you reduce salt intake, you are going to see your blood pressure going down. And very soon, if you have been on drugs, you begin to see yourself. Assuming you have been taking like 2 or 3 drugs, you see yourself moving from 2 drugs to 1 drug and eventually reduce or remove the drug totally. Now, another thing you're also going to do in order to prevent or treat hypertension is weight reduction. Some of us, especially men, have what is called truncal obesity. Truncal obesity, I was talking in one of my videos about truncal obesity. There are 2 forms of obesity, generalized and truncal obesity. Now, in truncal obesity, the amount of fat in your belly, pot belly, is so much. So if you exercise will help in breaking down of those fats and thereby helping your system, your heart, not to pump excessive blood. Do you understand? And then reduce the amount of work your heart is doing, because that is going to result in hypertension eventually. That is your pot belly that you have, and you're thinking you are a big man. These are some of the things that you have to do in order to control hypertension naturally without medication or very few medications. So if you have found this video interesting, why not share it so that other people can learn from it? And then like and then drop your comments in the comment section. If you have any question concerning what I have just taught, ask your question on the comment section. Thank you for joining me, and then thank you for sharing this video. Thank you so much.